here. So thank you all so much for joining today to talk about transportation. Woo! So today, yeah, thank you, Jenny. I love that. Thank you. Today we're going to talk about transportation. This is part of our current pillar goal. So we wanted to go over some of the standards and best practices for transportation. Earlier this year, we did a transportation survey with all the life enrichment directors. And the survey said that those campuses that have successful transportation, really all they're doing is following our current SOP and best practices. We asked for any new ideas, things that they were doing at the campus level to have a good transportation experience. And really, there wasn't anything new other than just they're following the standard. So we wanted to go over those things, and that way we can get all on the same page when it comes to transportation and how to have a successful system at the campus. All right, if you guys can please mute, or Kelsey, if you can help me get anyone muted. Thank you so much. All right, so as you all know, when it comes to transportation, we have two types of transportations mainly. The first one is medical and health related, so your resident medicals appointments. These are treatments, ancillary services, anything for your residents' health needs. And we understand that these are crucial appointments that need to happen for your residents' wellness. We also have resident experience and engagement trips. These are your resident group trips that fosters social interaction. Again, these are key for resident well-being, so that way they continue to maintain that social interaction with their communities, maintain friendship, and stay mentally stimulated. The resident group trips are vital for the overall well-being and should not be canceled for medical appointments or other things that come up in the campus. So questions that we always get is, who is responsible for transportation? And everyone in the campus really shares responsibility for ensuring smooth, efficient, and resident-focused transportation services. And this is exactly what we heard from those campuses where transportation is working really, really well for them. Anyway, anywhere from the ED all the way to social services admissions, everyone has a part on this. And so when we're talking about the executive director, they are supposed to support transportation operations, ensuring that the campus has the resources that they need. They help brainstorm solutions for transportation challenges, but they often do not consider LEA hours to be pulled for medical transportations. And they ensure that transportation is managed correctly without overburdening the LEAs. The DHS is similar to the ED, but they focus on the transportation adoption from clinical perspective, and they ensure that the nurses follow the SOP and best practices, including scheduling correctly and using the transportation platform. And we'll talk a little bit more about that here in a little bit. The nurses schedule the medical appointments, and they ensure that they're entered correctly into the transportation platform, and they have clear and constant communication about those appointments with the LED or TA to avoid scheduling conflicts. The LED oversees the engagement trips and ensures residents have meaningful social opportunities, and they manage the overall transportation schedule and oversees the TA if the campus has a TA. LEAs support resident engagement, group outings, and social outings. And the transportation associate oversees the entire transportation system process. So again, this is for a campus that does have a TA, ensuring accuracy and efficiency, provides education and training to staff as needed, and communicates with the LED, nurses, and other departments to ensure smooth operations. The DPO handles all vehicle maintenance and safety following fleet guidelines. The TA and LED are responsible for reporting any issues, but the DPO coordinates the appointments and repairs. The business office manager manages the billing related to transportation services. The therapy team coordinates transportation for therapy-related appointments. Social services schedules transportation for medical or social appointments that they oversee. And admissions schedules new admissions, hospital pickups. So again, we have that smooth transition into the campus. So as you can see, transportation is a TAWB process, a system. It's not just life enrichment and clinical kind of working together. It's everybody coming together to make sure that we have a good experience. So we're moving on with, again, how do we manage, right, transportation? There's a lot of questions related to how do we manage the amount of medical appointments that we have. Some campuses actually do have a TA budget. And my understanding is that, unfortunately, at the campus levels, you guys do not see the TA breakdown from the LEA hours. So the Life Enrichment Support Team will be sending here in the next couple of days, probably by next week, the TA versus LEA hours at every campus. Some campuses actually have a full-time TA budgeted, others not. So again, this will help you understand where you stand with that. But for those campuses that do have TA hours, we want to make sure, again, that they embrace, that they that they take over the transportation piece, the system. And so they will be dedicated to the medical and health related transport needs. So they will be covering all those trips required for residents' physical health. Now, when we're talking about LEA hours, those hours should only be allocated specifically for residents' engagement in experience trips. LEA hours should not be used for medical or health-related appointments unless absolutely necessary. But as we saw on the slide before, transportation is a TAWB. So who else in your campus can assist with medical transport if you don't have enough TA hours or something comes up last minute, right, where maybe the TA or somebody else is unable to do that appointment. Every campus should have at least 5 people that are on the insurance and that are willing and able to drive when these appointments happen. We all know that misuse of the life enrichment hours can impact the budget and reduce the available opportunities for engagement for our residents at the campus level. We understand that medical transportations are very, very important, but also are those engagement opportunities available to your residents is vital for their well-being. So something kind of new, is not new, but something that we really want to reinforce with this webinar is that life loop transportation is our standard for transportation management. So we don't want to use any more paper. So if you're still using, a paper planner for transportation scheduling, the Google Calendar, Outlook, or even sticky notes, we want to move away from that. And there's a lot of reasons why we want to use LifeLoop as the main transportation standard. One of those reasons is because we are developing currently a transportation department, and we need to gather the data that shows us exactly where do we stand as a company with transportation. And unfortunately, if we don't use a standard transportation system, then we are not able to gather all that data, all the transports that you guys are doing at the campus level. And when I say LifeLoop, for any campus here that uses Movi, that is in the Columbus, Ohio, or Lafayette, Indiana areas, you will continue to use Movi. So don't freak out, okay? LifeLoop is just company-wide, except for those 2 clusters that we have area transportation. So when we're talking about LifeLoop, this way is going to help us track all that data. Again, eliminates any missing or incomplete records and ensures that we have a system-wide consistency. It's going to help us understand the transportation needs, because we're going to be able to see how many requests campuses are submitting, how many approvals versus denials due to maybe lack of transportation availability, cancellations. It's going to help us understand the trends that we have around transportation. It's going to help us see what support do we need to provide campuses in regards to vehicles, staff, or scheduling as we move forward with transportation. And again, this is all going to help us improve the resident experience, not only from a social standpoint, but also from a health standpoint. So the steps when we're talking about how to request transportation are very, very simple. Even if you use Movi in LifeLoop or the same, the main thing that we want to do, right, is have access to the platform that your campus uses. Again, most campuses will be using LifeLoop, except for those two areas that I mentioned. Everybody has access to LifeLoop. If you're not sure how to access it, your LED at the campus level can assist you with that. But the first thing we want to focus on is family involvement. So when we are making a medical appointment, we want to ask those family members if they would be able to take the resident to the appointment. The reason for this, again, is that way the bus is not in use, but also it's important for families to be involved in their loved ones' care. We understand with today's society, right, families are a lot of the times busy at work or other things going on in their lives. So it may not be as easy for them to be involved. And that is why also we should have external transportation services available. These transportation services do have a fee most of the time. So it's important that we have ED approval for that, and that we have them set up with each campus. So if these two options, for whatever reason, are not a possibility when making a medical appointment, then we should be looking at our campus vehicle availability. And to do that is super simple. In LifeLoop or Movi, there is a calendar that will show you, right, the availability of the bus or the van at your campus. And again, that is going to help us reduce the amount of denials of residents that we can take or cancellations. So submitting the transportation request on the platform is super easy. We will have more training on that in the upcoming month. And once the submission happened, the TA and or LED would approve or deny that transportation request. So this is a pretty simple, straightforward process. Now, again, for those campuses that are doing transportation really well, there's a few guidelines that they're following, and there's a few things that we want to talk about through this. So the first one, which came out just in the last month, is the Motor Vehicle Safety Program. If you haven't read through that, I would highly encourage you to look through it. It's available on Compass. If you just type Motor Vehicle Safety Program on Compass, it will pop up. This is something that just came out. And we will also going to have hands-on training for all drivers and anyone that secures residents on the bus. So you will see an invitation come from your FMS and our LES here in the next month or two, letting you know that we would have a train-the-trainer for LEDs and DPOs to attend. So we're very, very excited to finally have a really good training for our drivers. Also, the bus phone. A few years ago, a couple of years ago, every campus received a bus phone. And I am, unfortunately, want to share that only about 32% of our campuses are currently using the bus phone. You guys are all paying for a monthly bus phone fee. So we really want to make sure that everyone is using the bus phone when they are driving the bus. The reason for this, one of it is our employees should not be giving their personal cell phone numbers to residents, families, medical offices, right? We are not paying for their phone bill. So they should not be giving their personal phone phone number. Plus, they're getting calls sometimes outside of their work hours, by family members or residents. So it is key that everyone uses the bus phone. The next thing, having backup drivers. I kind of mentioned, right? Having 5 backup drivers per campus. Again, these backup drivers need to be employees who are ready to drive. Sometimes we have some backup drivers that can never get off the floor, or they're not really willing to drive. So let's really look at that list of backup drivers that we currently have and select a few staff members that are able to assist with driving. Now, something new that came up on the motor vehicle safety program that just was released a month or so ago is that volunteers are no longer allowed to drive the bus. Okay, this is something that we've had in the past. So if you currently do have volunteers driving the bus, unfortunately, that is not an option any longer. Again, campuses that are doing transportation really well. The TAs, if you do have a TA, are assisting with life enrichment activities when not driving. And then we are scheduling in our transportation platform any medical appointments versus group trip days. And we're ensuring that there's clear scheduling and prioritization. We're considering transport time versus appointment time, right? We cannot schedule an appointment back to back due to that driving time. Again, we want to move to Life Loop only or Movi for those few campuses. And we're going to have nursing training coming soon with the DHSs and nurse floors as well. So they know how to input that transportation appointment, which is really easy. It only takes 1 to 2 minutes max to do. They always have their residents ready for pickup. Just like we're talking about driving time, right? Making sure those residents are ready on time to make it all the way to their appointments. And then having those vendor contracts, establishing local transportation partnerships within your community that can assist with some of those appointments that we are not able to take from the campus level. So next, to talk a little bit more about medical transportation efficiency, we have a great guest from the Southwest Division. She is the clinical support there, Corey Pinkstuff. So I'm going to give the platform to her to talk a little bit more how we can look at transportation a little bit different from a medical standpoint.
Wonderful. Thank you all for having me today. I just wanted to talk a little bit about the partnership because, like has already been mentioned, it takes that team approach to get this off the ground. Clinical teams historically are a little hesitant to embrace change, and that starts at the top. So we really need communication all the way around, and that is the key to getting the program running smoothly. So when we look at that, the DHS and the nursing leadership role is imperative when you start talking to your clinical staff about utilizing the transportation platform for your residents, and making sure that your DHS and the nursing leadership has not only knowledge of the policy and of how to utilize the platform, but that they can do it themselves, so that when they have staff and they're doing the training, that they can walk any nursing staff member that's having difficulty through the process. So the nursing staff training is going to require the DHS, the ADHS, the LED, the executive director, everybody walking hand in hand and communicating the same message to your nursing team. You can't rely on one training session. I think the campuses that I support that have had success have done an ongoing training. They've utilized huddles. They've utilized a see one, do one, teach one approach with the nursing. staff, and then monitoring the status of the appointments in CCM, because you've got to be able to have that follow up and that communication, especially if you've got a complicated situation or someone who has multiple appointments. Stepping back though and talking to the nursing staff when we're doing the training to encourage families to assist with transportation sometimes is outside your nursing or your nurse's comfort zone. So being able to identify transportation preferences upon admission for new residents or during resident first meetings for existing residents is a key component to all of this working smoothly. So the nurses may not be comfortable in starting that conversation. If the resident is able to be transported by the family, encourage and empower your nurses to ask family. Some families assume transport is included. We had my mother-in-law on one of my campuses, and my husband's family just assumed that that was part of the service that was provided. So teaching your nurses to be able to say, I see your mom has some upcoming appointments. Will you be taking her? Or how does your mom normally get back and forth to to appointments when she's at home? There may be a family friend that takes them to their appointments. We can discuss the campus availability and what that looks like and how that aligns with family availability. We want to empower staff to have those conversations because if families are present, I think we had already mentioned, if they're present at the appointments, that knowledge is key, and that communication from the office helps the care coordination. So a lot of times our families, the common concern is not knowing what's going on or not having those things communicated to them. But if they're at the appointments, then that relieves that middleman. Um, we also need to help our staff and teach our nurses what appointments are truly medically necessary. If we have a new resident admitted to the facility, they don't need the follow-up appointment within a week with their primary care physician because that need is being met while they're in the campus. So helping the nursing staff know what is and should be, being able to establish that those visits can be set to be scheduled upon discharge when they're going back to their community setting. We also want to know, can the appointment be addressed while in-house? We have a lot of residents that come from the hospital with wound care, pacemaker clinic, Coumadin clinic referrals, because that's what the discharge planners and what the hospitals focus on. Can those things be addressed while in-house and then followed up if the resident goes home or maintained in-house for long term? Was the appointment scheduled prior to hospitalization if they're coming directly from the hospital? So a lot of our residents have complex medical issues and they may have appointments long standing, and families come to us and say, well, we've got an eye appointment, we've got a follow up for a cataract, eye injections, a colonoscopy, all of those things. When they're with us for a short stay, we really want to focus on that rehab day and what appointments can be rescheduled for when they're outside the campus. We need to utilize our provider input. Ask the attending physician, is this necessary? Make it part of the admission review. So if those appointments are there, we just need to put in a tickler nursing order that says schedule these follow-up appointments on discharge to home. We want to be able to explore alternative nursing resources that also may reduce the need for offsite visits. Um, can we do wound care in-house? What about an in-house psych visit, podiatry, hearing, dental? Can we do the pacemaker check via phone instead of going to the pacemaker clinic for the pacemaker check and potentially, a Coumadin PTINR check? I know we used it more predominantly through COVID, but the telehealth possibilities still remain in place. Is it a situation where we could utilize telehealth? Is it in the best interest of the resident to get out? Right now I know we're battling flu season. Is it is it the best option for a resident to be making multiple appointments and being exposed potentially to a lot of the things that are going around? Could we do a telehealth? Each campus has access to iPads and we can set them up and do the telehealth visit. When we talk about educating our nurses, again, that communication, but knowledge is also power. And when nurses who have many, many things to do don't have access to the resources they need to make an appointment or to make outside transportation or to do all of those things, that's where the frustration builds up. And in my campuses that I support, when we first started talking about this, that was the feedback that we were getting. This is going to take me more time. It's going to be more confusing. I don't know who, I don't know when, I don't know how. So being able to show them how easy the transportation portal will make their scheduling and help coordinate that communication so they're not making 15 phone calls to schedule one appointment. It will give them the time frames that are available. So making sure that they're aware that they can pull that transportation portal up on the at the nurses station and access what days and times are would potentially be available for the campus to transport. Also ensuring that if it doesn't fit into our transport model, that they have access to outside transportation resources. If they don't know who and where and what they can call for the services needed, they're going to be frustrated and it's going to create more work than it is going to be benefit for the resident. So making sure that there's contact information for those outside services available at all of the nurses stations and keep it up to date, establishing who's going to be the one that's going to make sure that if one of the outside services is no longer in business, that we remove that. Or if there is a situation where we've added another service that they have, or if there is an ambulance service that would potentially do the stretcher transports, making sure that they're also available. And then including, and this is one of the things that we added, make sure that your appointment order in the medication record is specific with the transportation details for the appointment. So that will help the nursing leadership team follow up in CCM when they see those appointments, and they'll know that the transportation's been scheduled, who's going to do the transportation, but also include any specific needs. If it's assistive devices, items that they need to take, anything that needs to happen ahead of time, and then make sure that there is a process in place for the nursing team to communicate that so that the resident is ready at the time of the transport. Nothing will set everything amiss is if nobody knows that those things are happening, the communication's not there, the resident's not ready, and then we're already behind the 8 ball. So just communicating across the board with some of those key points will help make um, it a much more efficient process. And once your nurses start using it and utilizing it, they'll see how much easier it is than spending 4 hours on hold with multiple agencies trying to set up that transportation.
Thank you, Corey. We appreciate all the feedback that you have for us. All right. So as we move forward, right, with transportation, just a few things to keep in mind to put in action, in the upcoming weeks. Find your bus phones, the main thing. Again, about 67% of our campuses are not using their bus phones. If you cannot find them, contact IT. The phones have a tracker in them and they can tell you where they are located. And also make sure to have business cards ordered. I forgot to mention that on the previous slide, but there are bus phone business cards where you can put the availability for transportation days and also that number for the bus phone. So when you drop a resident off at their medical appointment or a family member, you can give that card so they can call back when they need to head back to the campus. Also, get your transportation platform ready. We will talk a little bit more about that on our transportation webinar module 2, which we are going to start that next week. And that is going to be for our DPOs, LEDs, and TAs. Of course, DHSs and EDs are welcome to join, but we're going to talk a little bit more about how to use LifeLoop, matrix care, and all those processes that we need to do to have, again, a successful transportation system from our end. So we appreciate everybody's time. I will go into the questions here. If you have a question, feel free to unmute yourself. I believe we have some things on the chat as well, so let me look through those. If I don't have the answer, we will find the answers for you. So let me go here in the chat. Okay. Can TAs attend the Train the Trainer? So the Train the Trainer is going to be for LEDs and DPOs because that way you guys can take that training back to the campus and train any new drivers. We can talk about TAs. If somebody has a full-time TA, I think that could be a good possibility as well for them to join. So more information to come on that. Jess says, so should we have 5 additional backup drivers outside of our TA? Not necessarily. You can have 5 total drivers. You can have more than 5 drivers, from my understanding, on the insurance. I think the 5 is kind of like a best practice, but I believe you can have more than that. Darla, do Medicaid residents get charged the same rate? So if you're talking about the internal rate that we have for our buses, I believe that gets right off, but that should be on that motor vehicle safety program guide in Compass. Ronnie, so whoever gets the appointment details first should be noted in Matrix for all appointments. I'm not sure what you mean by that. Feel free to unmute so you can clarify that.
So if it's been like, if it's already confirmed that we need the transportation or the set date and whatnot, whenever it's been input into LifeLoop, also be noted into Matrix?
Yes.
Okay. Somebody said yes, I'm not sure. So the piece that we do on Matrix Care from a transportation standpoint is the transportation request observation that the TA or the LED inputs for a mileage perspective, from a billing perspective. But yeah, I'm not sure what else. If you guys are talking about the doctor's order, right? That the nurses do, is that what you're talking about?
Like a progress note in for
So this is Corey. I'll jump back on there. There should be a physician's order or a nursing order for the appointment so that staff know how and when to prepare the paperwork. And in the special instructions of that appointment order should be included the transport details.
Thank you.
See, that's why we're building this synergy with clinical, because we don't have all the answers. Thank you, Corey, you're answering that. Crystal, which campuses are using Movi? If you're using Movi, you know. I don't have the list in front of me, but it is and I don't know if Deidre or Eric are here. They can probably mention much quickly than me those campuses, but it is in the Columbus, Ohio area, and also in Lafayette, Indiana area. So if Deidre and Eric are here, you're free to unmute and talk about it.
This is Crystal. I just didn't know if we were still going to use Movi since our sister facility is no longer affiliated with us. So I didn't know if we would just go strictly to Life Loop or not.
So if you currently are using Movi, you will continue to use Movi.
Okay.
Yep. All right. Nat said, our Life Loop appointments get removed from our calendar when residents discharge. Does this impact your data or reports? So when a resident discharges, right, that's good that the appointment is being removed, because if not, that will create some confusion. I mean, I don't know if that impacts the data. Again, if a resident discharges, we don't need to see, right, that transportation any longer.
Can I add something to that?
Yeah.
Daniela? What I'm finding is if a resident discharges or in any way, the appointment is still there, but the resident's name disappears. But the appointment is still in there.
Okay.
And we are confused if it's a month out and they are putting it in.
Yep.
We're like, who is this for? So that is something that.
Thank you for letting me know. I will bring that up to Life Loop.
Yeah,
Okay.
if we look back to, like, it's nice for our future appointments. And I mean, it does get noted in Matrix if we like did an appointment that day, but obviously like if they're not an active resident, like we're not usually going back into their profile, but sometimes we'll look back on like past days and we're like, oh, like it seemed like we had a busy day, but somehow we have gaps in our schedule because it'll delete some of them. Yeah.
Yeah, so it will delete the past appointments that happened. Okay, I thought that you meant like the
when
future.
it wipes their whole
I was like, oh, future's
profile.
good. Okay, thank you for bringing that up. I'll follow up with them on that. My area has a cluster transportation system. Are these expectations directed the same? So most of them are the same, but we can talk more in detail about those campuses using Movi. Does the QR code system take over having to enter mileage into key stats? No, the QR code that you guys have on the bus is not for mileage or matrix care. When the TA does mainly clinical medical appointments, am I understanding correctly that they're not to be billed under the LEA hours budgets? Well, when it comes to budgets between TA and LEA, if your campus has a TA actual budget for that position, you will see it at the campus level, like it runs all together, but technically they will come out of that TA budget. It's a little bit complicated because you guys unfortunately do not see that breakdown between LEA and TA hours. That's why our LESs will send all campuses that breakdown, hopefully to give you more guidance on, how many TA hours you truly have. So if the residents are Medicare or Medicaid, and it's medically necessary based on why they are admitted to a facility, we as a campus are responsible to transport per Medicare and Medicaid guidelines. If family refuses and outside resources available, the campus is required to ensure we meet their medical need. Correct. Yes. I'm not sure if there's a question with that, but yes, we do need to take our residents as well. Yep, to those appointments. But again, just kind of going with what Corey was saying, are all those appointments, necessary? Is there anything that we can do in-house by telehealth? Just being a little bit better at looking at those things. Are there standard transport times that we should be following? We do not have standard transport times. FYI, they are discharged from health center and admitted to another service line. Okay, thank you, Tanya. I'll look into that. How do I know if we have TA budget? The LESs will be sending that to all the campuses. And then any chance of getting Life Loop movie and morning meeting to communicate and pull appointments to the form? To communicate. We can look into that. That would take a project from IT probably to do something like that. All right, we only have 5 more minutes. If you guys have any other questions, again, feel free to unmute, put it in the chat. Hopefully this was helpful as we continue to move forward with our transportation system. Again, we understand each campus is a little bit different, right, from when we're talking about resident needs and the transportation resources that we have. But we know that a lot of these best practices can help make your transportation system a little bit better. So unless there's any other questions, you guys are free to go. We'll have a second opportunity to join this webinar on Tuesday. And then next week, Thursday, and the following Tuesday, we'll have the second set of trainings for LEDs, DPOs, and TAs. Thank you all for your time. Have a good one.